National Health Authority under Ministry of Health and Family Welfare, along with the government of Odisha, is hosting 2 days Chintan Shivir on Ayushman Bharat Prime Minister Jan Arogya Yojana and Ayushman Bharat Digital Mission. This is a good platform for knowledge exchange, sharing best practices, understanding the challenges of the states and accordingly addressing it at the national level, creating a common standard and a platform where all the states can seamlessly operate. States can also bring up their own schemes to move towards coverage of more beneficiaries. Some of the states have gone for universal health coverage, but they are all running on the common IT platform. This gives the advantage of a collective action. A lot of data gets collected across the country. Anonymized data of this health history of the patients can be used for many futuristic applications like predictive health solutions, also for clinical decision support systems. There is also possibility of developing AI solutions for not just predicting disease, also for disease surveillance and predicting disasters. Some of the states have started mapping the health data with climate data, geospatial data to create a health map, a heat map for disease as well as for disasters. So there is a huge application of the digital data which gets created through these 2 schemes and build AI solutions over it. We are concerned that the digital data creation across the country has to increase, and therefore health management information systems in our health facilities have to be implemented. So the manual, instead of creating manual prescription or health record, digital health records gets created, because then only the new technological solutions can be applied, and these solutions will be more relevant to the local requirement. Otherwise, there are many AI solutions in health coming up which are tested against foreign data, means Western countries' data, or sometimes very limited hospital data or limited geographies. So these solutions may not be very relevant for different parts of the country, which need to be tested against the local data. Let's say for Odisha, the AI solutions which are developed must be tested against the Odisha data. Then only their accuracy can be assessed or established that whether it can be applied. But good part is there is huge possibility. Odisha government is already working on creating a digital ecosystem by which its public hospitals and private hospitals can generate more digital health records, and based on that many solutions can come up. So there is a huge potential, and these 2 days Chintan Shivir in Bhubaneswar will focus a lot on Odisha specific requirements also. At the same time, whatever best practices are happening across the country will get to know here to the Odisha government and Odisha health care system. So this is a big advantage. Odisha is one state which has onboarded on these 2 schemes only 9 months back in the month of April 2025. But it is going very fast. So we are looking at Odisha as a fast growing state in adoption of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana as well as Ayushman Bharat Digital Mission. And I am sure this 2-day Chintan Shivir will help Odisha to achieve that and maybe become a forward state at the national level.
So, as you mentioned that, so can we say that AI is going to play a vital role for medical science as well as health sector?
AI is going to play extremely important role in the healthcare. It will play a role both for a high-end clinical treatment like robotic surgery, many more surgery which will use precision of technology. On the other hand, AI will play equally very important role in easing out the problems of frontline ASA workers, doctors, nurses, and many of their non-clinical work, administrative work, will be taken care by the AI. And so that the professionals can actually concentrate on more treatment, on more, surgeries, or the treatment of the disease, not on administrative work of documentation, etc., which AI itself will do. More so with the digital health, the record can seamlessly be shared across the health facilities. So now the health systems will actually start talking to each other. We have already created a digital public infrastructure where the health systems can talk to each other, and therefore we have this open interoperable platform for exchange of health information, for unified health interface, and even including national health claim exchange. So with this system in place, the need is more and more adoption of this by the health facilities like hospitals, laboratories, pharmacies, and also used by these healthcare facilities for empowerment of the patient by providing digital health records. Patients get empowered because they start getting the digital health record on their mobile app. They can create their longitudinal health history, and they can also get to know what is there in the future and take precautionary steps for their better health. The aim is not just the curative care, but also the preventive and promotive health care, and I believe AI will help us in doing that.
Last question on the inaugural day, 2 MOUs were signed. How it will help in health sector?
We signed 3 MOUs today. We signed first MOU with Bhasini, which is a Government of India initiative, whereby all the informations which we provide through our portal, through our transactions, are made available in local language. This will be a big advantage for Odisha too, because we are starting with the 12 languages, and this includes Odia language. So now people can get the information in their own language. They can access the platform their own language, dashboards in their own language. On SMS they get on their mobile will be in their own language. So this is one advantage we are going to get. It will also help in future that how the patient communicate with the doctors. They talk in their local language, but the software will catch that local language and create the digital record. So while the communication is happening verbally in local language, digital records gets created. It's a big advantage which is going to come with this MOU. Second important MOU we signed is with the Indian Institute of Sciences, Bangalore. This is for building AI based solution for frontline ASA workers, so that ASA workers can actually do the screening and distinguish between the simple symptoms to a more chronic or a serious diseases. They can identify whether the fever is a normal fever or a viral fever or a typhoid or something new outbreaks. So this kind of solutions will be developed. IISc already has a center of excellence for AI in healthcare with a support of 500 crore from Ministry of Education, Government of India. So this AI Center of Excellence for Health will help us building many more solutions for the healthcare, and we are going to use it in a big way. It will enable ASA workers. It will also strengthen the capacity of professionals like doctor, nurses, allied health professionals. Third MOU we signed with the National Accreditation Board of Hospitals, NABH, and this is because NABH is coming up with the idea that while they accredit the hospitals, they'll include digital health as one of the parameters in accreditation. So this will promote digital health, which will in turn promote integrated health. And this is important because in times to come, the integrated health will create a collective platform where many more solutions can be run. So with this, we are hoping that more and more hospitals who are looking for better accreditation will come on a digital health ecosystem. So these three MOU is going to help not just the National Health Authority, but all the states in taking advantage of either language or technology or even accreditation parameters.